Hi, I'm Jen Zimke in the Department of Political Science.
And I'm Colin Swearingen, also in the Department of Political Science.
I'm Erin Johnson, Department of Biology.
And we're Crisis Mappers. I co-founded the Crisis Mappers Network with a colleague in 2009 here at the very first conference on crisis mapping in the world. It's an international network. And it's exciting to see how crisis mapping has evolved over time. Crisis mapping is basically getting stories, data, information, all kinds of different tools and getting it on a map so you can understand what's going on for situational awareness and to make sure that we have roadmaps in places that had no maps before. So I'm here with my colleagues, Erin and Colin, to tell you a little bit about some of the projects we do out in the field crisis mapping.
So I've been part of the Honduras Immersion Program for 5 years now. Honduras is a developing nation, and what we do is we take students, alumni, most of our doctors, we take physicians, they are also alumni, down to Honduras, and we run what are called medical brigades. As I said, Honduras is a developing nation with very poor public health infrastructure, especially when you get into rural and remote areas. And so it's our goal to, through our brigades, provide as best medical care as we can with the resources that we have to these people that are having trouble meeting their basic health needs. And so we go out into communities where people are do not have access to physicians. They do not have access. Some of them don't have access to transportation, access to a road. And what we do is we set up and we try to see as many members of the community as we can in a day. We're down there for about 10 days, and currently in that 10-day period, we're running over 1,000 patients. So 1,000 patients per trip. And what we're trying to do now is move towards a data-driven approach, meaning that we collect and analyze data from previous years. And so what we do is we head down there with real information about the infections, the different diseases that we saw, and we can take that information and apply it to the next year's trip and make decisions, make informed decisions about what medications we need to take and how to better serve and meet the needs of the patients. And so actually crisis mapping has been a huge part of this process in taking what used to be just guesswork into real data and real outcomes. And so now we're using this to map our communities, to show how close they are to a main road, how close are they to a clinic, where's their main source of water. And what this all does is, again, help us provide the best patient experience that we can.
As Erin said, we go to some of the most poor areas in Honduras and we provide medical treatment to them. I've been going to Honduras now for this is my 3rd year, and when we get there, I take students out into the field. We try to map out communities so that we can build relationships with community leaders, so we can understand what's going on the ground, and so that we can better provide services to even the local fire departments. A couple of years ago, there was a town called Calpules. Their main source of funding, or their main source of employment, is a tobacco factory that almost burned down. It took a long time for the firefighters to get out there, in part because of Hurricane Mitch, which took bridges out. These firefighters didn't even know where the bridges were out, so they couldn't even get to the town. So part of our goal is to go out and find out where all the roads are, the bridges, map them out, put them together, and in time provide that to the local community officials. Last year, we actually had to map out a community from the back of a pickup truck. Our current system is we use paper. We draw things by hand on Google Images. One of the problems is that Google is wrong on some of their locations. They will tell us that a village will be in one spot when it's actually about 5 to 10 miles away. And we don't know that until we get down there, which means we have inaccurate satellite images and base maps. So we're trying to raise $3,000 to improve our technologies on the ground, and with that money we can get tablets so that we can do mobile mapping. We can go on the ground and while we're walking through the communities, update all of the data, all of the facilities, all the buildings as we see them. We can better map the roads, the bridges, the rivers, the streams, all the transportation. We can also maybe get some wireless internet connection because there is no internet down there. In fact, most people in these villages haven't even heard of the internet or Google. So with that help, we can do a lot to help the people in Honduras. We can also help students here at John Carroll. We want to do mobile mapping community projects here in University Heights, Shaker Heights, and Cleveland Heights. And with your help, we can do that. Thank you so much in advance for all that you're doing.